4:45, right? Is it early, or is it, I can't read it. I don't have my phone out. All right, I'll wait 2 minutes. There, you had me all discombobulated, Michael, thanks.
Somebody's gotta fix that pot.
I hope he does. Because I don't have it. There's no conversation. How would I ever get that?
Get so many things.
Okay.
Hi, Tom, how are you?
Good afternoon. It is 4:45 on March 11th, and I am calling this Human Resources Committee to order. We have a quorum of members in chamber. The first item is approval of January 8th, 2024 minutes. They're in your packet. If no questions, I'll take a motion to accept. Motion by Herbst, second by Martins. All in favor say aye. Aye. Any opposed? That passes unanimously. Number 2 is the Human Resources Report for February 2024. It's in your packet. Any questions for the director? Seeing none, we'll put that on file. Number 3, discussion on the role and responsibilities of the Human Resources Committee. As per a discussion, probably last year, November, in budget season, there were numerous members of this body that wanted to look through every committee. I don't think we've done it for a while, so our city attorney has worked feverishly to find the information which was in your packet to make sure that our role is what you feel it is, and that the role that we do play is documented correctly. So I don't know, it's in your packet. Any questions about what's the roles are? Are you okay with the roles as written?
So what was the intent really? Or was just identifying the word, wherever the words Human Resources Committee is listed, or is it really meant to revise and relook at some possible changes to the role of the Human Resources Committee? I don't know where you want to try to lead us with regard to this. I think there are some places that that we may want to look at a little bit more specifically and change, but what would be the process for that, and how do we account? I don't sense that happening today, but I would think that there's some wording that may want to be taken a look at.
May I, Madam Chair? Thank you, Gary. As some of you know, this has been quite an undertaking. We started out with CISM, and Thursday night I'll be going back to them for the 4th meeting in a row, looking at their responsibilities. And tomorrow night at ED will be the 2nd time I'll be back at that committee, looking at their duties and how those interact and intertwine or may overlap with some of the CISM duties. Yours may be a little bit different. But I've done now HR, and I'm working on public health and safety for Monday night, and then finance for the last meeting of this term. Originally, I didn't know if you were going to plan on having a committee of the whole, so the whole council could adopt at the end of the term descriptions for each committee, or if you wanted to include that as part of a new term. adopting your council rules, and then committee responsibilities as part of, your descriptions at that inaugural meeting or one thereafter. That's completely up to the council. So I'm not suggesting you need to make any changes. I'm just bringing them to your attention. And I don't think any of them should surprise you. I mean, they're all pretty straightforward. But for HR, it comes not only from the code references, but also from the handbook. So what I've done for each committee is I've pointed out a list of where they appear in the ordinances. And the HR committee doesn't appear that often, except for collective bargaining, and then also for interviewing classes of employees annually to discuss mutual concerns, goals, and objectives. That was a number of them through Chapter 2, all of the personnel appointments. And I thought you might find some of that interesting. We've talked a little bit about the utility and their ability to manage and compensate their employees. So I don't know that those issues have yet been divided or sorted out. I think at the last committee of the whole, I was directed to revisit the ordinances, but not with much more detail than that. And that's going to be a large undertaking as well. So the HR committee also appears numerous places in the handbook. And then I also intended to attach a copy of Madison's ordinance, which didn't get, it was submitted but not included in the packet, to give you an example of a city that actually lays out all the duties and responsibilities under the committee name in their ordinances, where in our council rules in 2.16, we just list the standing committees, but their duties and responsibilities aren't technically in Chapter 2. We find your duties where your committee names are mentioned throughout the code, in essence, and for the HR committee in particular in the employee handbook.
But chapter 2 is where that's where that should reside with the standing committees.
I think so.
And an understanding of what those standing committees do.
Right.
It just says there's a standing committee. Well, that's nice. And then you have to hunt and pack, which you did very well. Thank you for that with regard to what we do. I think that has to be somewhat codified into where it belongs in Chapter 2, where that identifies the standing committees of the city council, so that it's all in one place.
Well, and in the distant past, like the 1966 resolution I've been referring to, back in the day, a mayor would make a recommendation of descriptions for the committees, and then the whole council would discuss it and adopt it. I mean, there's many ways you can get to the same end, but I thought since it's up to the council, the committee, any mayor could certainly too make recommendations and submit a report to the full council, but it's always up to you to decide how often you want to review your duties and make changes or amendments to them. But it hasn't been done in all the time I've been here, so I've learned a lot. I've thought it's been pretty interesting looking through the code at all the references to all these various committees.
So can I ask the chair how you want to proceed then, or?
Well, I guess what I understand is that, do you see anything in here that you would like out? Is there anything, that there's some things in here that we're not doing. Do we want to start doing them, or do we want to take it out of the duties?
Well, I think we have to talk.
Right.
We have to talk about
Right.
it first.
Right. So, this can be a beginning, discussion, but I think we're going to hit into next term. I don't know when our next meeting is. I don't have my phone. But this is kind of what the alders, that people asked to look at, because there were some questions, and then we said we would do it with all the committees. I don't know, has anybody else have a problem or a issue with any of these, or that they would like to take something out, or keep everything in and make sure we're doing exactly what we are saying we are supposed to be doing in Chapter 2? Go ahead.
Well, then, so I think it's on the last page, 1304030, management control of the utility. And the last sentence is, "The Director of Public Works and Utilities will abide by and participate in all policies, benefits, compensation packages, etc., as established by the Human Resources Department and committee, which are ratified by the City Council." I think in some other places, I think the wording is a little bit more fuzzy with regard to that. So does this wording stand, or do we really need to rework an understanding of the relationship of the Director of Public Works and Utilities with regard to this committee and the HR department? I think that's almost, I think we need to do that. That's essential, because I think this says one thing, and I don't know where else that is in the, that it's a little bit more fuzzy somewhere else, and I don't know where, I don't have that in front of me right now, but I'm just saying that this is quite clear with regard to the process, with regard to which the Director of Public Works and Utilities works, with regard to, specifically with regard to compensation packages. So I think that needs to be reworked. How we do that is, I guess, up for discussion at a later date, I would think. So do we direct someone to put together that kind of wording, or so that we can talk about that?
Okay, I'm going to let our HR director answer.
Yeah, I don't want to steal our city attorney's thunder, but I was in the same meeting when we went over this with an outside attorney, and his exact words were, yes, the charter says that about the Utilities Commission, but he said in his experience, he's never once had someone that would challenge that and want to go rogue on it. So basically, it's one of those things where we just kind of said, hey, we trust you, and now we're kind of getting bit by it. So that's kind of where we are with that. So,
Well, I think it's the obligation of the City Council to fix it somehow, and I guess it starts here.
I'm just going to have Ann.
I will, Gary, just say briefly that while the ordinance says that might not be enforceable, given the case law that we have, that's probably overridden our ordinance. So that's going to require a deeper review, as directed by the Committee of the Whole, to look at exactly what authority is given to the utility or the utility manager by having created a commission under the statutes, and what has been reserved to the HR committee.
Right, the Wisconsin statute speaks to that. I don't have,
Well, there's case law, actually, that says that once you create a utility commission under 660805, you automatically give to them the management and compensation of their employees. You give to the director.
Right.
Regardless of what our ordinance says. I would say the state case law would trump the ordinance. So there are probably many places in our ordinances that need to be fixed or brought up to date with statutes or case law, and this is one of them.
okay.
Thank you, Madam Chair. Yes, and Ms. Jacobson just answered the question I was going to ask at our Committee of the Whole. That was my direct question about the involvement of human resources. And at the time, it felt like the response was, yes, that would likely not be legal without essentially abolishing the commission and starting something else. So, yeah, I'd certainly be eager to see if our ordinance holds up in regard to the case law and state level elements. It sounds like it won't, but if by chance it would, that would sure be pretty efficient in terms of what we had discussed at the end of that Committee of the Whole. Thank you.
So we have questions about that probably needs to come back, but the other things in here, there's So, Chapter 2.06.050, all officers appointed under the terms of this chapter shall be interviewed at least once annually by the mayor, together with the Human Resources Committee, to provide each a formal opportunity to discuss mutual concerns, goals, and objectives. I don't know how that meeting is supposed to work, because if this committee convenes, it is in open session, so I'm not quite sure how that would work. So, I mean, I guess my point of view would be to take that out and put that into, we take concerns when they come up to the podium. I don't know if there's anything formal, but I don't know how, I guess we could have a special meeting or in a meeting have that. It's up to you what you guys want to do with this. It's just interesting to see what we were supposed to be doing. And it includes all persons appointed. So that includes the street superintendent, the building inspectors, engineers, project managers, engineer, community development director, and the zoning administrator. We would be doing a lot of interviewing. Go ahead.
I mean, that statute does say, by the appointing authority and/or the Human Resources Committee, so that's
Yeah.
something that you can offload to them.
Yeah.
And that's, I don't know if,
Well, that's
You know,
that
we need-
one, yeah,
we-
2.12, but the one at 2.06050 is,
050.
yeah, if you look at that one.
oh, okay,
Yeah, it said and,
together with Human Resources Committee, yeah. But that's assessor, attorney, finance director, and the public works director, those,
yeah, it's the department
the
heads.
department heads. Which I could see value in that, but beyond that, the
Yeah,
minute
the-
the minute
that's minutia.
of management would probably
Yeah.
be, something that this committee doesn't really need to delve into.
Now that you pointed that out, Madam Chair, 2.10.050 says and,
Yeah.
2.06050 says together with the
Yeah.
committee, 210.050 says and the committee, and 212.040 says and or the
Yeah,
committee.
yeah.
And in the near 26 years I've been here, I've never seen this implemented, so I don't understand the background or genesis of it, unfortunately.
Maybe this is language that just needs to be cleaned up, that we can, so that there's, either a level of consistency or something that, we decide, what the committee needs to be concerned with and what can be offloaded to other managers.
Yeah. What's interesting, let me see. So the website, have you looked at that? And then the website is the annual wage and salary, supervision of all policies, reclass, enforcement, conduct all labor. I think if you look at the February 25th staff memo of what is stated on the duties and responsibilities, those look accurate, actually. So I guess my question is that the only thing I see that I would like cleaned up is that those references to the interviewing. If we're not doing it and we don't plan on doing it, I'd like to get rid of that. I don't know how you feel. The other thing is, I think we're still looking at the utility and human resources, the wage. I think that's still in legal. Go ahead, Gary.
Well, and maybe if we could get the Madison it's curious to see if there are things that are not here that we should be thinking about in addition to what's already a part of the ordinance with regard to maybe what we should be doing. We don't know what we're not doing if we don't know what there's out there that is under the purview of a Human Resources Committee. And maybe we should be looking at that to see once what else is our obligation as a standing committee of the city council.
Okay. So what do you want to be brought back? The Madison? Do you want to wait, think about this, get the information from Madison and bring it back to the next meeting? I'm seeing nods. Is that consensus? That was, okay. So that's what we'll do, is we won't take action on this tonight. We will get the Madison descriptions to see if there's any other differences. And I asked the committee to look at these and come back with kind of the next time with some ideas on what you'd like to keep or what you'd like to get rid of, so. Sounds good? All right, we're going to put that on hold. The next one is discussion and possible action, approving hiring an outside attorney for upcoming negotiations with the transit union.
I think this was something that we wanted to do. This is by no means a permanent thing. We wanted to do it pretty much this once because, number one, I received notice from the transit union that they're not going to have their union president negotiating the contract. They're bringing in some of their heavy guns, one of their VPs and all that kind of stuff. So me not being one that want to bring a knife to a gunfight, if they're going to do that, then I just assume have an attorney there because there are some things where, we're just now onboarding a director. That group has been kind of, I don't think chaos is the right word, but it's been a lot of things going on. And I think we really need to, even if we have to spend a little bit more money, we need to tighten that up and make sure that we put the city in the best position that we can in this next negotiation, because these negotiations, and I've talked to my colleagues around the state, have really been tough when it's come to transit. I know there's at least one in arbitration right now. So, this is just something that's kind of somewhat of a precursor, but just making sure that the city is going to get the best deal that we can get.
May I say something too? Yeah, James asked me if we could hire outside legal counsel and asked specifically for Nate Miller, our previous assistant city attorney, to negotiate this contract, with which I don't have a problem. I do have $70,000 total for my annual legal budget this year, and with some of the litigation we have, it's already becoming kind of challenging, but I agree this might be the place to use outside counsel. They're already trying to schedule meetings in April now, and I think we gave you the original. I don't think the procurement policy requires me to get permission when a director comes to me and wants outside legal counsel. If we don't feel we can provide that expertise, I have the discretion to do that, but I wanted to be very open and transparent about this because all three of the contracts are going to expire this year. Police and fire will be at the end of the year, transit's at the end of June. So to get that going, I had contacted Nate. He sent me a retainer letter, and I believe, James, was it $225 an hour? It was $225 or $250 an hour, and that will be a significant expense, I'm guessing.
Right. And again, this is only going to be for transit. We're at this point, for police and fire, we're going to do it in-house like we've always planned to do. So it's just we feel like there are some extenuating circumstances to bring in an outside attorney on the transit.
Thank you, Madam Chair. You said they may be bringing in big guns, but those guns don't include an attorney then? They were just senior level union people?
The person is not an attorney. She's a VP. And I mean, this is what she does for a living. This isn't just something she does once every 3 years. And this person is She's known by her reputation. I'll just leave it at that because I don't want to get into too much. This is a public meeting. I just really think it's a good idea to have. And if you take a look at with the transit contract, the way that it is, there are a lot of things that they're going to be going for this year. And I've kind of got that at the water cooler about a lot of the things that they're wanting to do. And just their pay structure to start with is very confusing. And, I think you guys are all witnesses to that because we had that grievance. It's very, 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 it's nowhere near as straightforward as other step 1, step 2, step 3. It's starting this place and you're here for 6 months, and then for a certain situation, you go a year. And it's just a lot of stuff that we just feel better if we have a professional litigator. And I think a lot of it too, I have heard through the grapevine that they're wanting to change a lot of the verbiage again, which would really help having a legal mind with that.
What is the estimated number of hours then for Mr. Miller? Does anyone know?
Now, I really don't know. I know that the last transit, and I know this is not typical, but I know the last thing was done in 2 days. I remember because it happened right before the last HR director left. But that was between her and the union president, the VP, and none of them were involved in this. So, and like I said, what I've been hearing around the state is that everyone's having a hard time.
Thank you. Yes. Well, one, I'm a little concerned about the cost. Two, I'm a little concerned about kind of dealing with the transit negotiations differently than others, just because of perhaps the tone it sets. So I do understand the desire for maybe more surgical expertise at the table, but I won't be supporting this one. Thank you.
Well, and there are other things. Again, we're just now having a new director coming in, and there's been a lot of things in flux over there, and they know that. And anyone that knows anything about bargaining, when you have a position that you feel that's going to make your position stronger in negotiation, they're going to use it. So, we need to make sure that we're as prepared as we can be.
Thank you.
Yeah, and I think it's to the director's point is that when we went through the police and fire negotiation 2 years ago, we did use outside counsel for that because we were in a point where we were between HR directors. So it's not unprecedented for us to use outside counsel for the contract negotiations. So I'll be supporting this.
Any other questions or concerns? Okay, if not, I'll take a motion to accept. Okay, motion by Herb, second by Martins. All in favor say aye. Aye. Opposed?
No.
That passes 4 to 1. Thank you. Next. Okay. Now, we have a presentation, Chief Cop Barnes, Laura Scuderi, and Aspirus Tara Drager, and discussion and possible action approving the creation and hiring of a community care paramedic for the fire department. Welcome.
Hi, guys. Thanks for your time. Very excited to have the opportunity to discuss this community care paramedic position in the city of Wausau that could change local healthcare as we know it, as well as address some of the obstacles we're up against in the city of Wausau and in the county. I don't think I need to introduce everybody because you just did, right? So what I'd like to do you guys all have a copy of the PowerPoint and the job description?
Yes.
Okay. I think what we'll do is we'll just get right into it, starting with the PowerPoint. I learned a lesson at the banquet. I can't see. So some of the objectives of this position is to improve the overall health of the Wausau community. As leaders in the community and as department heads, we're always looking for innovative ways to improve the safety and health of our citizens in the city of Wausau. And we want to collaborate with our partners, our stakeholders, if you will, throughout the city and throughout the county to make things like this happen and to improve the health and safety of our community. This will also help in reducing the use of our ambulances as the first access point to healthcare. We transport a lot of patients that don't necessarily need transporting because they don't have the ability to reach out and use some of the other resources that they don't know are available to them, which this person would be that first line of information to help our patients get the care that they need. It would reduce the emergency room usage by non-acute and repeat patients, kind of like what I just said. One of the stats I just pulled up were our 10 highest utilizers in the city of Wausau over the last 6 months. They've used our ambulance for transport 215 times, which means 430 times a year on the average. If we could bring that down just with 10 utilizers with this community care paramedic, that's somewhere in the area of 400 transports that we could reduce just by using that one variable. We want to reduce readmissions of I just said that, didn't I? Reduce readmissions of patients to hospitals for the same diagnosis, by using the referral and the communications with our local hospital, Aspirus, making sure that we can follow up with patients that have been discharged and make sure they're following the directions that they might not have understood at the time of discharge, whether that means taking the proper medications and making sure they follow up with whatever directions their nurse or their doctor gave them. This would build relationships with healthcare resources within the community. We've already been working very collaboratively with the Marathon County Health Department and making sure that we can make this person knowledgeable as well as our patients in the city knowledgeable to know what our resources are and using them all properly. We could make sure that we are talking with the health department on a consistent basis, talking with the hospital on a consistent basis, and making sure that we're using the proper resources for the proper patients. We want to be able to assist the community outreach coordinator at the PD with access to health care for clients, meaning we would have an internal partnership with our internal stakeholder, the police department, and making sure that with their position there, they would work hand in hand on a daily basis to address a lot of the issues inside the city, including the unsheltered community. The next slide, you can see a quote that just talks about working collaboratively with stakeholders, like I just talked about, and all the different things that this position can conquer. So we'll skip right past that one. There's a couple example programs, and I apologize, I didn't include their programs in your packet, which I do have in a folder here, but the Madison Fire Department is one of the bigger ones in the state of Wisconsin doing this. I think they're up to 6 community care paramedics at the moment. And, it's been very successful for the city of Madison, and it's done all these things that I talked about. And it's one of those things that they keep track of, and just like we would, is to set goals, to make those goals, and to report back all the numbers and data on a consistent basis, whether it's quarterly or annually, and go from there through this program in its infant stages. I talked a little bit about the referral process and being able to refer back and forth. This slide here just talks about what some of the diagnoses could be: COPD, CHF, pneumonia, diabetes, stroke, and the homeless initiative, making sure that we focus on certain things, hit our benchmarks, and then keep growing the position from there. We don't want to overwhelm the position by growing it to a max capacity before it's successful. So we want to guarantee the success by starting at a reachable goal and building from there. It also talks about the home visits, and I might have skipped over that, so I'm going to talk about that a little bit. Not only are we doing those things I talked about with medications and making sure that people are taking the proper care of themselves in home, but we're also going to be making sure that their homes are safe. Right now across America, falls is the leading killer of our citizens across America, and we want to make sure that we're looking at home safety issues like throw rugs, different things that are causing trips and falls throughout the home, making sure they have working smoke detectors, making sure they have working CO detectors, and doing all these things that really just take a minute or two to go through the home while we're doing a home safety check and making sure that these patients are taking good care of themselves. Some of the tools that this community care paramedic would need would be making sure that the patient has good nutritional resources in the home. Talks about trips and falls, so I guess I got a little ahead of myself there. I apologize. ADRC referrals, fire and life safety assessment, and a prescription drugs assessment. So all kind of things that I skimmed over there. But again, I think it's important to mention that in the communities, especially in the city of Wausau, from the, talking to our constituents and our patients in the city, it's a lot easier for them to allow fire department personnel to come in and work with them in these cases compared to someone like the ADRC or even the police department. It's just something about the fire department where they're more willing to listen and more willing to allow us into their home and to make these differences. And that's why so many communities are going towards this program. Hope you weren't offended, Chief. Next slide, talking a little bit more about the healthcare of the homeless. Community care paramedic would serve as an asset to the WPD Community Outreach Coordinator in providing alternative access to healthcare and needs, and then building relationships with North Central Healthcare and other healthcare assets in the community to reduce use of ambulance calls and emergency department visits. As you all are aware, we're setting records every year for how many transports and how many calls we're getting in the city of Wausau. Last year, we just missed 7,000. Will be no surprise at all for 2024 for us to break that 7,000 mark very easily. By how many, I really don't know, but this would be one of those things that would keep our paramedics in-house and not spending time on patients that don't need transport so that they're more available to the people that actually do need transport. So that's very important to note. Some of the things we'd be looking for in this position would be a paramedic with 3 years of experience, a background in community care paramedicine, having that certificate. There is a class that makes you certified in community care medicine. Must be able to build relationships and work well independently, equipped with a cardiac monitor and proper evaluation tools and dedicated department labeled vehicle. Those are some of the startup costs that you'll see in one of the slides coming up. Talk about funding and working collaboratively with our community partners. What we're looking at right now, and not limited to, because we're still looking for more funding, and we'll always continue to keep looking for funding. But right now we have a verbal agreement with Aspirus Hospital to provide 40% of the funding to this position for 3 years over the trial period, as well as the Alexander Foundation contributing 40 to 45% of that, leaving 15 to 20% still on the city, which is why I'm here educating and presenting this discussion. So I think I did mention it, it'd be a 3-year trial with quarterly and annual progress reports. It'd be a data-driven program, and it must have a positive impact for us to keep growing and keep moving it forward. And I can see it, not only like Madison growing into more positions, but growing over a community and collaboratively with our other fire departments. I've had sit-down meetings with the chiefs of area departments in the county, and they would not be opposed to growing this program and making it collaborative over the years to come. So it's one of those things we can explore in the future. The next slide is the paramedic program costs. I'm not going to read that all to you, but you've all seen it, and we'd be willing to answer any questions you might have on it. It just talks about the costs, the best we could come up with the cost over the first 3 years of the program. Cost benefit analysis. Again, I don't want to read it all to you, but we got plenty of data and way more we can share. I didn't want to put too much in this packet for this meeting, but anytime you want more data, I can certainly provide that for you. So again, I won't read this slide to you unless you have any specific questions about any of the points that we put in there. Before we get into the next slide, I just want to give you guys the opportunity to ask any questions on that, because with the next one, I'm going to invite Tara and Laura up to speak with you a little bit about the slide, the next slideshow that's put together. So any questions for me? Go ahead.
So when a call comes in, does it come into 911, or how I'm sorry, when a call comes in, how does it, it comes into maybe not an emergency number of some sort.
Sure.
Somebody would have to decide, this is an ambulance run, this is for these community care people, right?
Yep.
That decision, I trust, is with your department with regard to dispatching.
That's a great question. I'm glad you asked it. What we would see right now is working on a referral basis with the health department as well as the Spirus, and a referral basis coming from our firefighters, paramedics that are in the field, and the Wausau PD officers that are in the field. Anybody could make a referral and talk about what they see as a possible need. As far as anything going through dispatch, what's going to happen is we're going to respond to every emergency call we get from dispatch, and then if the paramedics get on scene and decide this is something that our community care paramedic could handle, they would make that referral process, because it's just impossible for them to cover all those things while they're responding to the next call and trying to get back in service. So it's a great question.
So it is by referral, then it's pretty much at least beginning a
To start
referral
out.
type of thing. Okay, thank you, thank
bet.
you.
Thank you.
Any other questions?
Yes, thank you for the information. Just one question, because it had come up at the Police and Fire Commission, some kind of tangentially related topics. There'd been statements that in the future, there was, the chief had expressed some desire or intent to limit services to the unhoused, to individuals who could only prove that they were from town through an ID or high school history or whatever. Essentially, it sounded like deporting to the city of origin was a desired strategy that was articulated. I do not agree with that strategy at all. So with this, I just wanted to make sure if this moves forward and does well, there'll be no limitation then with referrals or services to that kind of geographic exclusion of the individual. This would be for everyone who needs it.
Yeah, I can't speak intelligently to most of that. I'm not unaware with some of that data you brought up, but my vision of this position would be to improve the overall health of our community, anyone in it. We don't, when it comes to health, anyone that's in our city, we're going to take care of. It really doesn't matter where they're from, if it's a car accident or whatever the case may be. So I would say that I could see this building into something that's not limited by anything other than how many patients can one person see without growing it to a bigger program, which I think in 3 years we'd be able to prove that very easily, that this is saving money overall and there's need for more. And it's going to change healthcare as we know it. In the 1970s, we changed fire prevention as we know it through a nationwide initiative, and I think EMS is right on that tailboard of that same idea right now because of the issues and the obstacles that the healthcare system is facing throughout the nation and quite frankly locally. So.
Well, that's great to hear. That certainly sounds like the best approach. Thank you.
All good? You guys ready? Come on up.
Good afternoon. My name is Laura Scuderi. I am the health officer for Marathon County, and I'm here just to share with you a little bit of data that I pulled together to give you a sense of the population health issues that we're dealing with when we're talking about a program like this. So that is in your packet. A lot of the data that I'm discussing today was pulled from Marathon County Pulse, which you can just get to by going to marathoncountypulse.org. That is a database that we retain of population health data related to our area. So it's a really nice resource. If you haven't checked it out already, I recommend you go there. It's not just what I'm going to be discussing today, it's all kinds of wonderful health data that is available to you. So in your packet, I'm going to be discussing the data points that I believe are in there. And the first thing I want to talk about is the number of Marathon County falls and related EMS calls. So in Marathon County Pulse, when you pull up a data topic, you'll get a box that looks like this. And in that box, I'm just going to explain a few things and what they mean so that you can have a reference. So if you look in that box, and I'm not sure, do you guys have color? Is it colored on your packet? Okay. So there will be an arrow that points in a direction. If the arrow is pointing up and it is red, it means that it's a statistically significant trend. So again, it's over time. So don't just look at the data points themselves. This has gone through some statistical analysis to determine whether or not it's a trend for our community. So when you look at the number of Marathon County Falls related EMS calls, the data is from the Wisconsin Ambulance Run Data System. And that upward arrow indicates an increasing trend, a statistically significant trend. And if you are in the website, you can actually mouse over the icons, and it will tell you, give you the definitions of them in Marathon County Pulse. So I recommend going in there. But you can also break down this data based on race and gender. and you can even break it down by the location of the fall in this one. And in this one, it indicates that more people are calling after falling within their home. So I thought that was worthwhile data for you to review. I'm moving on to the age-adjusted death rate for falls, so I won't go too much into this because it does involve kind of a statistical analysis of what age-adjusted means. But I did want to let you know that we are seeing an uptick and a trend that we should be paying attention to in the age-adjusted death rate from falls. And moving on to the number of Marathon County deaths due to falls, again, another uptick. So we are all aware at this point that Marathon County is aging. Our aging populations have specific health considerations, and one of those priorities is falls. As you can see here, we have a statistically significant trend. Marathon County saw 38 deaths due to falls in 2022, but I really wanted to highlight and mention to you that this is probably a very conservative number because there are some deaths due to falls that may happen weeks or months later, and where the precipitating factor was the fall, but it was hard to determine the actual cause of death due to the chronic disease or other issues that may have been exacerbated by the fall. So when I speak to physicians about this statistic, they all say the same thing. They think it's a very conservative number. The next thing I want to discuss is the health provider shortage area. In the shorthand we use for this is HPSA. The city of Wausau is actually designated by the Health Resources and Services Administration as a health provider shortage area. The attribute represents the number of full-time equivalent practitioners needed in the Wausau area so that it could achieve the population to practitioner ratio that it needs. The target is determined by the type of HPSA, and the city of Wausau is designated as non-rural. These numbers don't seem like much. 3.67 FTE medical providers are needed, 3.86 mental health providers, but it's very difficult to recruit for these positions, and the retention and mental health providers and medical providers is especially difficult, especially for populations with very complex needs that intersect with issues related to poverty. This essentially would mean that we'd have to find 4 medical providers and 4 mental health providers that aren't in our area currently and have them build caseloads in our area that effectively would focus on these underserved populations. So clinics in our area have been doing so for years. I myself used to run Bridge Community Health Clinic, and I remember how difficult it was to recruit in our area. I know for a fact that the other hospital systems and other health providers within our area, recruitment doesn't end. We're always recruiting. It's very difficult to find a provider that is willing to move into the area that doesn't have experience in our area already. And it's also very difficult to find a provider that wants to work with underserved populations in particular. This recruitment continues to be an ongoing battle. So we recruit a few and then others move out and back in. So it's been a challenge. We'll move on to some mental health related statistics here. So the number of Marathon County residents that did not go to a mental health provider, that was a measure that I wanted to call to your attention. Again, another statistically significant trend. It's resulting in further reliance on our emergency services, including crisis care, EMTs, and emergency rooms. You can see here that it doesn't yet include 2023 numbers, so we do anticipate that will go up in the next year. Another piece I'd like to show you is the mental health adults feel that life is slipping out of control. That is something that we track through a consumer profile. And that's in 2021 and 2022. So again, we don't have the most recent data points on that, but it's something that we are anxiously watching. And of course, the last one, which is mental health households that receive mental health care. While we are seeing that there is a need for services, we are not seeing that residents are seeking or getting access to necessary mental health services. So it causes residents to utilize services that have easy access, like EMS or ERs to manage their mental health conditions. And obviously, it's not an optimal use of those resources and does transfer costs onto us as patients. So now I'm going to turn it over to my colleague Tara Drager, who's the Director of System Health, Community Health, and Health Equity of Aspirus. I'm going to take my folder. So.
Okay, that sounds good. Hi, thank you for having us tonight. I'm really here to represent Aspires, to give you kind of the why we're invested in this program and why we think it's valuable. In keeping with the trend of giving you some data, I did include some data in your slide packet, in your packet, on the current state of our emergency department admissions. So you can see the trend there is steadily increasing, but what you don't see by these numbers is the complexity of the patients that we're seeing. So an ED really is set up for emergency medical care, right? You go in with chest pain. We're trained to assess the situation and, develop a care pathway from there. What we're not necessarily trained to do is to triage patients and to really understand what the underlying needs are around transportation and housing and things like that. And so we're seeing a lot of patients that really have those complex needs, which is taking our staff away from, some of the medical emergencies. With that, we are also in kind of explaining some of the data that Laura gave around mental health. We've also seen an uptick by almost double in our behavioral health calls. So although we've worked really diligently to increase access around behavioral health, I agree that it's really hard to recruit and it's really hard to meet the need in our community. And so while those are patients, while we've improved access, there's still wait times for behavioral health. So while those patients are waiting to see a behavioral health provider, oftentimes they do use those services that are easier to access, like the EMS services or the ED. And so we're having to triage those patients because we can't find them the appropriate resource at the appropriate time. So we feel this program will kind of help give that safety net, if you will, to those patients. So why is Aspires invested? We have many reasons. This program ties in with a lot of our areas of focus. So it was mentioned before, falls prevention, right? Most of our patients that come into the emergency department are falling in their homes, upward of 60%. So if we can go into the home, we can assess the situation, we can start to prevent some of those falls, we can hopefully work together as a community to really address that. As far as readmissions, length of stay, those are things that we're always working on as a health system, right, to control the costs. Another big initiative that we have is getting the patients the right resources at the right time. So oftentimes we see them accessing, the wrong resource, and then the patients that really need that resource aren't able to access that. So getting them the right resource at the right time is really important, as well as disease specific. We are part of a community paramedic program up in Merrill, Wisconsin. Our Aspires Hospital supports that program as well, and it's referral based, and we focus on disease specific states like diabetes, COPD, CHF. And it's referral based. It's been very successful, and so we're hoping to expand that as well. So we're already part of it in one area, and now just expanding it to another area. As well as, so in addition to hospital-related focus areas, we also look at the community health focus areas and health equity focus areas as a system. So we're focused on mental health, substance use, and falls prevention for our focus areas, and so this falls in line with that. We also just launched some screening for social needs and referring them to community resources. So this is a new requirement for hospitals to really understand what are our social needs of the patients that we serve and how can we work with our community partners to get them the resources that we need. So this really ties into that. So we're looking at those social determinants of health. Those are those non-medical factors that influence health outcomes. So that can be transportation, housing, food insecurity, social environments, built environments, what do they have access to once they go home? So we really feel like this partnership is really strong. We can treat our patients while they're in our hospitals. We can assess, we can diagnose, we can treat, we can recommend protocols. But once they go home, we really would rely on that partnership to keep them safe and keep them as healthy as they can be. So I think our staff said it really well. So I put 2 quotes in here from our staff. So one is Mason Luca. He's our director of nursing at Aspires Wausau Hospital. And his comment is the support for a community paramedic program would allow EMS to aid in assessing the social determinants of health that are impacting our community at a great, at a great level. And they would offset that resource demand because that's really where where we see the need is getting patients the right resources. Another quote by Dr. Clark, he's an MD in the emergency services. He sees EMS as an integrated partner in the healthcare system. Really they have the distinct opportunity, EMS does, to kind of be that partner, and they're really positioned to address those social determinants of health. So with that, I'm going to turn it over to someone. So any questions? Go ahead.
Thank you. Thank you for the information. You had stated that Aspirus has strived to improve access to things like mental health services and so forth. Could you give us a little more information on the steps Aspirus has taken to expand mental health and alcohol and drug treatment programs for the community there?
Sure. So within our behavioral health department, within the last couple of years, we've, and I don't know the exact number, but we've hired a lot of staff. Psychiatry is still a really difficult position to fill, especially child psychiatry, but we are working out how we can use the resources that we have to get the patients the care that they need within our behavioral health. So we've advanced some of the referrals and some of the navigation available to our patients so that, when they make a call, somebody knows who's available and where we can get them in within the system. So we've also expanded our medically assisted treatment programs within our system. So we serve a fairly large geographic region, but we want our patients to be able to get access all over the place. So we've extended those services, and where we don't have a physician, we've used telehealth. So that's been fairly successful. And then out in the community, we are part of, some of the initiatives. We do have an arm of community health funding that helps support some of these opportunities in our community. And so we're at the table for those discussions and trying to be part of the solution.
Thank you. And then one last question. A portion of Aspirus is a nonprofit. Is that correct? So when you're trying to improve access to the community, like the unhoused and low-income population, then is Aspirus then supporting fiscally or financially that access? What percentage of services then as a nonprofit is it offering low-income Wausonians, like if they have problems with access with psychiatry and alcohol and drug treatment programs?
Yeah. Can you elaborate on that a little bit?
Sure. So with these services, some of them difficult. You said it was hard to employ psychiatrists and so forth. I'll just distill it into kind of rough but simple terms. If a portion of Aspirus is a nonprofit, are you then, to a portion of the low-income or unhoused population, are you then providing free services in terms of access, or how is access defined by Aspirus?
Yeah, so to answer that, the majority of our write-offs, so because we are a nonprofit, anyone that enters our ED, we don't turn away. We do provide services for. We do a large portion of charity care, so write-offs for those that may not have insurance and things like that. But we do work collaboratively with the resources in our community, like Bridge and the Free Clinic and things like that, to get the patients the right resources that fit their situation, if that makes sense.
It does. Thank you. That's helpful.
Yeah.
Thank you.
Yep.
Good evening. To some degree, I think I'm here for moral support. I've watched the speakers you've spoken to before work diligently to create this program. And through a law enforcement lens, I'm pretty impressed because we're always coming here with initiatives, ideally, that create these efficiencies, like how much is it going to save? And often secondary to that is, but what does that mean for the service? And so a couple initiatives that we've been involved with, that was the key, which is we want the best services possible for our community. And I think the evidence clearly exists that there's money to be saved, both for the city and for our partners. but through my lens and the lens of the police officers that respond all day long to people in all sorts of different situations, many of the same situations that our paramedics respond in an ambulance to, there's a better service we can provide them, and I think this fills that gap. To be able to avoid riding in an ambulance to the emergency room, if that situation were preventable, I think that's key, and that's something that this program really identifies and has the ability to do. The component that excites me the most is the ability for the community care paramedic to partner with both officers and with Tracy Rieger in the work that she does. We recognize that on a regular basis, those individuals we're dealing with might be dealing with, as Mr. Killian identified, two things, mental health and AODA concerns, but they're also dealing with significant health issues. And those health issues are the things that are being targeted here. COPD, the amount of unhoused population that are diabetic, and then that ultimately ends up in an ambulance ride, sometimes with our staff finding them. To be able to prevent that through education and through getting them to resources that are less restrictive or less expensive, or maybe not at 2 o'clock in the morning to address those needs, all by proactively going out and identifying those individuals. And those of you familiar with our CART program, which Ms. Scuderi was key in a previous role in helping us identify, we wanted to reduce the amount of hospitalizations through crisis, through our 5115 statute. And the concept is, let's create relationships and work with people and educate them on what to do when you start to feel this way that prevents you from having to be hospitalized. And I think that exact same model is what's occurring here. And I know that we can build better partnerships, provide better service, and have a healthier Wausau as a result of a program like that, just through those individuals that we're dealing with on a daily basis. Even if I just wanted to narrow it down to the unhoused population, and that would be a percentage of the work that's being done here, we will have healthier people, we will have better outcomes. And I'm very proud of the work they did. It's not my work, but I am 100% supportive of that. And I think it's going to help be one spoke in the wheel of solving many of the community issues that we're dealing with right now. I'll answer any questions, but I probably won't have complex answers to any of them. Thank you.
Any further questions for anyone?
That's exactly why I'm a huge fan of collaboration. Thank you, guys.
Okay. Well, as it says, this is a 3-year commitment, 15 to 20%. I guess you'll figure it out in finance, Chief, why there's a range. I'll take a motion to accept.
Motion to approve.
Okay, motion by Gisselman, second by Killian. All in favor, say aye.
Aye.
Any opposed? That passes unanimously. Thank you, everyone. Okay, the last two, items 6 and 7, are going to be taken off the agenda. Sorry for the last minute. Last Friday, the mayor emailed me. These weren't ready for prime time. There was kind of a passing of the ships in the night with the staff, so the administration and staff want to continue these discussions. We will expect them, both items, back. Okay, with that, I'll take a motion to adjourn. Motion by Herbst, second by Killian. All in favor, say aye. Aye. Any opposed? We are adjourned. Thank you.